Hi, my name's Jesse. I'm with SBCC, and today we're going to be doing a sinus x-ray. I've got 4 views that I'm going to do. I'm going to do a lateral, a PA, a parieto-canthal, and an SMV. So, before I get started, I'm going to clean off my bucky. When your patient's face is especially coming in contact with anything, you want to make sure it's clean for them. All right. So all my projections will be done at 40 degrees, so that's my SID. And the main reason we're going to be doing these projections are for air fluid levels in trauma. So my entire central beam is going to have to remain horizontal throughout the entire exam, otherwise we will distort the air fluid levels. All right, I'm going to go get my patient now. All right, now that our room's set up, I'm going to go get our patient. Madeline?
Yes.
Hi, my name's Jesse.
Hi.
I'm a student with the radiography program, and I'm going to be doing your sinus x-rays today.
Okay.
Can I get your full name?
Madeline Ortiz.
And your date of birth?
11/23/93.
Any chance of pregnancy? Okay. Now, she's not wearing any earrings or any necklaces, but I checked for all jewelry possible. And I'm going to shield our patient now. So, first, we got the shield on, and then these wrap diagonally across. Okay, now if you'd like to have a seat, we're
This
good.
one?
No, not that one. That one might block out some of
Okay.
the lower sinuses. So if you'd like to have a seat right here. Okay, so we're going to start our series with the lateral projection. I'm going to slightly oblique the patient. So I'm going to slightly oblique the patient to reduce OID. For the lateral sinuses that show all 4, basically what we want is, we want her inferior orbital meatal line to be perpendicular with this edge of the IR. We want our interpupillary line to be just perfectly perpendicular with the IR, just like the CR. And we want our mid-sagittal plane to be parallel. So, the great thing about these new DR systems is they've got this laser right here that makes it quite easy to guide right across the line. So I'll just raise her orbital meatal line slightly there, and then bring her slightly forward. And now it looks like I'm centered pretty much a ½ inch to about a full inch posterior to the outer canthus. So this is a right lateral. I'll be marking it with the right one, and I'll collimate in slightly because we do not need that much skull. Sit right about there, and 75 at 10, maybe 12 at the most would be a good technique. And so I'd say hold your breath, suspend your respiration to limit movement, and X-ray. Okay. So for the next one, I'm going to do a PA Caldwell, and normally a PA Caldwell has a 15-degree angle, but since we have to keep our CR completely horizontal for air fluid levels, we're going to use the head to position. All right, so if you'd like to scoot back slightly, and now we're going to scoot you forward slightly and put your nose against the center of the IR. Perfect. And now we're going to use her head to position almost a 15-degree angle. So now we have the IOML perpendicular to the CR. And so there's our laser again. Looks pretty good. Just collimate in because we don't need that much skull. So this horizontal CR is going to exit at the nasion. And yeah, all looks good so far. So I'm going to hit that with the left marker right there. And again, I'm going to do 75 at 10, maybe 12 for this digital. All right, so now again, hold your breath and try not to move. X-ray, all right. So, next, I'm going to pull her out of here, and we're going to flip her around in our nice little wheelie chair. All right, we're going to scoot you back. Oh, Close your eyes. Actually, that's absolutely my mistake. I'm going to be doing the waters next. So this is a parietal acanthial projection, which means it goes in through the parietals, exits the acanthion. And for this one, are you relaxed? You okay? Mm-hmm. Sorry, this is a little bit tiring. So the next one, we're going to have her OML form a 37-degree angle with the IR, so she's going to lift her head up. And another good angle to remember is our MML, our mentomeatal line, is going to be perpendicular with the IR. And like I said, because it's a parietal acanthial projection, our CR is going to exit the acanthion. So if you go ahead and lift your chin up and touch it against the IR for me. Perfect. All right. Left marker. All right. Hold your breath. X-ray. And for that one, again, I forgot if I mentioned or not, but I'm using about 75, 10, or 12 throughout the first three. All right, you can go ahead and relax your neck, and we're going to turn you around again. All right, and for the last one, you want to try and be quick because it's quite uncomfortable for a patient, especially, you know, if they've been in a motor accident or anything, just checking their air fluid levels. They might have limited range of motion, so throwing their head completely back could just be uncomfortable, tiring, or disorienting. Okay, close your eyes. I don't want to blind you. So the next one is the SMV. Our goal is to get our IOML parallel to the IR, and we still have a completely horizontal central ray, and we want the mid-sagittal plane also to be perpendicular. Both gonions are supposed to be equidistant, so there's not going to be much rotation of the head. We want the mental point to superimpose the frontal bone. So, go ahead and lift your head up and point your chin to the sky. All right, I'm going to lean you back till you touch. There we go. All right, so, super above there, looks good. Oh, see we have tracking on this. Take the tracking off. Careful of your head. All right. So that looks good, and don't forget now that this is our right side. And so I'm going to kick the technique up a notch. I'm definitely going to do a little bit more KV because we're going through the occipital bone that's quite thick. So I'd say 85, 80-ish, maybe 20 mass would be a good digital technique. So then, all right, hold your breath. X-ray. All right, ma'am. Relax. I'm sorry, was that uncomfortable? Okay. So that is our 4 views for the sinuses. We'll talk about some of the criteria and things you see in them in the next video.
All right, this is an image of the lateral sinuses. And basically the lateral sinus criteria is pretty similar to that of a lateral skull. You want no rotation to be visualized right here in your sella turcica. You want your orbital roofs to be superimposed. All 4 sinuses should be visualized right here. And, you know, the frontal sinuses should be there. Ethmoids, your sphenoid. This is primarily for the sphenoid, but all 4 should definitely be presented good. Again, all of the sinus images will be shot with a horizontal beam because it's specifically for the air fluid level. This is the PA axial sinus. This was shot, also it's called the Caldwell method, shot with a horizontal beam. And the main thing for this image, sorry, I'm getting a little shaky. The main thing for this image, just like the skull, is to have the petrous ridges in the lower 1/3 of the orbits. But for the sinus, it's to demonstrate the frontal and anterior ethmoids right there that are circled in red and green. And this is a pretty good image itself, except I personally would have collimated out a lot of the frontal bone here and collimated out some of the mandible. But yes, overall good. So this is a picture of a parietal acanthial. This is the Waters method. From the looks of it, it looks like it was shot using a cone, which is an attachable filter to be attached to the tube. Now, some of the main points for this are, we know the mentum meatal that I mentioned is perpendicular. Our OML is creating a 37-degree angle. The main thing is we want the maxillary sinuses and the orbits to be symmetrical. They look pretty symmetrical in this image. And the main focus here is the maxillary sinuses, which are colored green. I circled them in green right there. We want the petrous ridges, which I put a little red line on, to be under the maxillary sinuses. If they are superimposed at all in the maxillary sinuses, it's not a good view to view the maxillary sinuses. And the last image we have here is of the SMV we did, where they threw their head back to create a parallel angle with the IOML. So basically this image, I can start just by critiquing the image itself. The collimation isn't great. We do not need all of that occipital bone in there. We could definitely collimate up to about there. But, and I mean, being that the collimation isn't right, that means that the CR entrance probably isn't perfect on this either. But what is demonstrated needs to be demonstrated. This is mainly for our ethmoid sinuses, right here circled in green, and our sphenoid sinuses right here I circled in blue. And it's got pretty much the same positioning criteria that the skull does. We want the mental protuberance to superimpose the frontal bone, the anterior part of the frontal bone to be specific, not any part. We want the mandibular condyles, which are, again, right here, to be in front of the petrous ridges, which are going to be right there. And so besides the collimation on this image, I'd say everything else is great. So, just to reiterate, we are doing this exam based on a mesocephalic skull. And so you should always be able to cater to your patient based on their skull type. Just use the positioning lines that you know and learned to cater to your exam.